Hello, my name is Roberto Giugliani. I am a medical geneticist working in Porto Alegre in the south of Brazil, and I will approach the topic supporting the creation of a national network of experts and or multidisciplinary specialized expert centers for rare disease. I am the founder of the House of Rares, a new initiative in Brazil, and I will present my experience to you. So, what was the initiative taken? I can say that in the beginning, we created an institute, the Genetics for All Institute. It was founded by clinicians and scientists to promote the access of patients to diagnosis and treatment of rare genetic diseases in Brazil. And at some point, we met with Casa Hunter. Casa Hunter was an organization founded by families of patients with rare disease to promote a comprehensive integrated care of these patients. So we joined these efforts, and then together we created House of Rare, or Casa dos Raros. That is a center for comprehensive care and training in rare diseases. So we started to build a facility on my city in Porto Alegre in the south of Brazil, aiming to providing multidisciplinary clinical care to patients with rare diseases, to have a diagnostic laboratory, also to promote expanded neonatal screening, perform some research, basic research, translational and clinical research. We will have an undiagnosed disease program, also a rare disease registry. We will perform natural history studies, and we'll have a biobank and provide training in rare disease for health professionals, and also information and education to the public. So what were the circumstances that motivated our organization to undertake this initiative? Well, I have to say that Brazil is a large country, is half of South America, and now has 215 million inhabitants, which is the world 50. And there are few rare disease reference centers in the country. We have 27 states and less than 20 rare disease reference centers. And in fact, these centers have very limited resources because they work on the public health system that covers 75% of Brazilian population, but very limited resources. And even the best ranked centers operate in a way that do not improve the huge diagnostic delay. I will talk about our experience. We have a center in the south of Brazil, in Porto Alegre, where I work. It's a very well maintained and very good resources on these centers in human resources and also equipment. And it's a very sophisticated center, but even that, we have 3,000 patients in the waiting list for a consultation due to a suspected rare disease. So we should do something different to improve the situation. So what did you aim to achieve with this initiative? So what we intend is to have a rare disease center in Porto Alegre, in the very south of Brazil, and this will be the first of a network of rare disease centers covering all 5 Brazilian regions. A second center is already planned for São Paulo, and then we'll have centers in the northeast, in the center-west, and in the north Brazilian regions. So what method we used? In fact, the main task was to establish a partnership with the society. And this just to exemplify, we were able to mobilize the main partners in the society, the government, the football teams, all the parliament. And this is an example of the Rare Disease Days. We are able to motivate these organizations, and also have a very good presence in the press, in the media. And we engage with the society. I think this is key for the success of this initiative. So what has been our experience in learners, and as we develop this initiative, I would say that the most important is to is to have a group of people that is very motivated. And in this picture, we have a group of people involved with the House of Rares. There are entrepreneurs, there are scientists, patient advocates, there are lawyers, health authorities, and health professionals, and people from the society that they're just motivated to voluntarily contribute. So this is was the key task. And what has been the impact to date in our healthcare system or beyond? Well, the fact is that we are almost ready, our buildings are almost ready to start operations. We had this huge support from the society. This building was made especially with donations from the society. We established agreement with the national, state, and city health authorities. So when we start operation, we already have in place these agreements, and we established partnership with universities, academic centers, laboratories, and hospitals. And we intend to start operation still this year in the second half of 2022. So these are my presentation on this initiative. If you have questions, do not hesitate in asking me. And I thank you very much. Here is my email address if you want to make any comment or questions. Thank you.